Okay, well, this is 1 minute ultrasound cardiac output. First, I'm going to get the patient up in their left lateral decubitous position because I need to measure the left ventricular outflow tract diameter. I'll get the parasternal long axis window with the probe marker pointed towards the patient's right shoulder. And once I do that, I'm looking at the left ventricular outflow tract. And what I want to do is optimize my image so I can see the aortic valve leaflets opening and closing. I'll freeze and I'll cine back to a period when the aortic leaflets are at mid-systole where they're open. I'm going to measure just at the aortic annulus at the base of the leaflets. And here I get around 2 centimeters as a typical sort of measurement for the left ventricular outflow tract diameter. Then we're going to get an apical long axis view. I'm going to use this apical long axis view to measure the LVOT VTI, which is the second measurement we need for this calculation. I'll put the pulse wave Doppler just apical to the aortic valve leaflets, and I'll get a VTI. Once I do that, I'm going to need to measure the VTI, so I'm going to tell the machine that I want to outline the VTI. We'll use the manual button, and outlining that, I get a VTI at 15.24 centimeters. Your cardiac output is pi r squared times your VTI times your heart rate.